tell me who is a candidate for, weight loss surgery. Because, I'll see some patients who come to me for, say, a tummy tuck. And then when I spend my, time with them, do their consultation, I see that they are overweight. Their body mass index, and I'll let you kind of describe what that means, is,
Right.
sometimes 35, sometimes even 40. And they just think that potentially, plastic surgery is the first route for them. They're like, well, I just want this skin removed, or I want to lose weight, I want liposuction. And
Sure.
we spend that time with them saying, listen, that's not the first step. And so that's when I send patients over to you guys to kind of talk about that. So who actually is a candidate, and talk a little bit about that.
Yeah, and so that's a pretty big misconception, I feel, amongst a lot of people, from family to friends, and other physicians. When we hear bariatric surgery, we typically think surgery. And so I really wish it was called, just, optimization, because you're truly taking somebody from where they are and making them healthy. It doesn't mean it's surgery. So if someone's
Mm-hmm.
looking to lose 5 pounds or 15 pounds or 50 or 150, I have ways to help all of them. And sometimes patients might come to you and say, I kind of want this figure changed, and it's great. And if you can do that up front, it's wonderful. But if they need to lose more weight or make it a safer option, well, then we can do both. And instead of just changing a figure or the shape or the shell, we're able to really help optimize everything on the inside, from the heart to the lungs to the liver to everything. And in addition to doing that, with about a 5-minute operation, we're able to get some weight down. If you're a candidate that's just looking to say, what can I offer? You can be any of those patients. Again, if you're looking for a small amount of weight, we have myself or dietitians talk about different types of diets. There are thousands out there. I can help coach or guide you to get that. We have our own products. And so sometimes we're doing protein powders or protein meals. And you'll hear a lot of these commercials on TV, and they're all probably pretty good, but we help design ours and help and really know what our patients are getting. If we want to go a little bit to say, hey, I thought maybe 15 pounds, but then in reality, maybe we should look at maybe losing 50. That's where the BMI comes in. And so body mass index is going to be based on your height and your weight. And so we have criteria. I think you might have some help guidelines and help us to decide what's kind of recommended. Ultimately, we have to talk about maybe what insurance requires if we're going through that, which we can get to in a minute too. But currently, it's recommended if you're 30 or higher, you're going to be what's called obese. And so that gives you some risks. If you get to where you're 35, sometimes we start talking about insurance coverage, maybe looking at more surgical options for those patients. And then specifically 40 and higher, it's going to be called morbidly obese or morbid obesity. And so you doing a tummy tuck, you can comment on that too. The risk benefit ratio changes a little bit. I think the expectations and results might change a little bit. So if they come to see me for any of those discussions, then we can help tailor what's best for them to get that BMI, body mass index, down to a safe range, helps their internal organs and their overall quality of life to feel better. And then if they're looking to have some kind of tummy tuck or cosmetic procedure, the results are just better. They're long lasting. I really feel like they're just better.
Yeah.